Ghana is currently experiencing a troubling increase in hepatitis B cases, prompting renewed calls for the rapid adoption of a birth dose vaccination policy. With over 12% of the population already affected by the virus, this policy is crucial to protecting newborns from infection and addressing the spread of this persistent public health threat. In this report, ChannelOne News' Kwama Siao Mafo highlights the story of a middle-aged man who has been living with hepatitis B for 16 years.
Hepatitis B, a potentially deadly liver infection caused by the hepatitis B virus, remains a major health issue in Ghana. Kwame, not his real name, is one of the estimated 3.4 million Ghanaians living with this chronic condition. His journey began in 2008 when a routine health screening revealed his hepatitis B diagnosis, a discovery that has left him devastated.
The time I was diagnosed, I wasn't happy with it. I was uncomfortable at all, because I would say, how did this thing come? But I took it like, okay, since it has come, whatever it is, I have to just be monitoring, having the background as a medical laboratory scientist, and we always want to check. We go to friends and every year to check my status, viral load, and check my liver function test, and even do general check. Most of the times, once in a year, I do.
Hepatitis B presents a serious challenge in Ghana, with approximately 12% of the population infected. The virus can lead to severe liver complications, including cirrhosis and liver cancer. Despite the availability of vaccines and treatments, many Ghanaians remain undiagnosed, untreated, or unaware of their condition. Kwame's battle extends beyond physical symptoms. It has taken a heavy emotional toll on him. Over the years, he has struggled with deep depression, often feeling that his life has lost its purpose.
They should treat people differently, and they should be able to encourage people with hope. You have this, we have seen these people because of their experience. They are seeing patients. This is a number. Maybe you don't want to show faces. At least let the person have certain belief or hope that, oh, these are the things. I can show you, these are people that have come. It's similar. I'm treating this person 5 years ago. He's been on it. But you have the chance. But sometimes you're thinking maybe about 1 year, no, when you say something, no. Yesterday, that's why I landed in hospital. Because it's kind of depression. I wake up and I wasn't feeling okay. I feel like doing something to take my life. I became worried, extremely worried. I'm thinking, what sickness is retarding my sleepiness? It doesn't make you happy and all that.
Mental health issues are often overlooked in the management of chronic diseases in Ghana. The country's healthcare system is already burdened by limited resources and a shortage of specialists. For individuals like Kwame, the psychological impact of living with hepatitis B is immense. He is now seeking counseling to cope with the emotional strain of his illness.
When I was going through depression, a doctor that see me as a specialist, there's little he can do. So I have to take the decision and go to psychiatric, because someone advised me that when you go, maybe they can do some injection or something, then you'll be okay. And they give me some medication. And maybe, I don't know whether it's a liver friendly, but I think it's better than what I'm going through.
Kwame's health has worsened with a recent diagnosis of liver cirrhosis 8 months ago.
I find sleeping difficult. And then you see changes in your body, and the body pain, back pain. Because at this level, it hasn't, though it's still a cirrhosis, it says early cirrhosis, but it is in compensated state. So most of the symptoms doesn't come out, but you get also a bit of nausea and that. But because of reading, if you have tongue fissure, a bit of crack, whitening I'm developing it, and then gas issue, hiccuping and all that. So when you are doing, you be patching, then that one will even put fear in you.
Although hepatitis B can be prevented with vaccination and treated with antiviral drugs, many Ghanaians lack access to both. The cost of lifelong treatment, which can amount to thousands of Ghana cedis each year, is unaffordable for most.
Medication within a month, and this 250, and the other, and roughly about 2,000. About 2,000.
For a month.
That's if you limit yourself to, because I'm supposed to see psychology too. Every meeting is 100 cities. That one I stopped. I couldn't go. Thinking about the cost, I decided not to go.
There have been appeals for the government to include hepatitis B treatment in the National Health Insurance Scheme, which currently covers only a few chronic conditions. However, progress has been slow, leaving individuals like Kwame to bear the heavy financial burden. In an interview with ChannelOne News, Theobald Owusu-Ansah, president of the Hepatitis Foundation of Ghana, emphasized the need for the government to take on responsibility of funding hepatitis B treatment.
The drugs are very expensive, but what I've done is that we negotiate the price on behalf of the patient. We don't pass through the doctors. We go straight to the manufacturer, the pharmaceutical companies, that we have so many people who are living with hepatitis. So why don't you reduce the drug so that people can access it? And this is the thing we have been doing. And even some of the doctors are even buying from our organization because it's cheap. So some of the doctors are also getting from us, and the patient too is also getting that. And we are also happy to say that now hepatitis C treatment is free in Ghana, but the B is not free. So we are appealing to the government if we can also make hepatitis B treatment free.
A major obstacle in the fight against the virus is the low rate of hepatitis B vaccination at birth. Mr. Owusu-Ansah noted that the absence of the birth dose policy contributes to the rise in mother-to-child transmission.
And to eliminate the disease, you have to start with the birth dose. The birth dose is something everybody is championing it, that the cost effective is to vaccinate the people in the year 2 birth within 24 hours birth. And Ghana last year, the majority leader, Honorable Afro-American, said government is going to introduce birth dose. But now we are even ending 2024. Still, the government have not implemented that policy.
The program manager, Dr. Achu Seke-Kwao, for the National Viral Hepatitis Control, stated that the Ghana Health Service is collaborating with all stakeholders to accelerate the implementation of the birth dose policy.
We know birth dose is very dear to the hearts of anybody talking about hepatitis B, particularly our civil society partners. And as a service and as a ministry, I think that we work very hard to meet the aspirations of our people.
Dr. Seke-Kwao assured that the government is working to increase vaccination campaigns and expand access to screening and treatment.
It is when testing kits and medicines are bought in bulk supply, the price is actually lower. And we have partners like Africa CDC. They are thinking how can they help Ghana so that we are able to get bulk purchasing of some of these items at a cost that is lower. In fact, not only Ghana, other African countries. So, because when you have 50 countries, each of them is going buying, we are paying more than when the 50 pool their resources buy from one. So it can actually help a lot when people are able to test and know their status and talk about it.
Attempts to combat hepatitis B in Ghana have been ongoing for years, with various initiatives aimed at increasing awareness, promoting vaccination, and improving access to treatment. However, Kwame's story, like many others, underscores the urgent need for robust action as Ghana races against time to meet WHO's goal of eliminating hepatitis B by 2030. Reporting for Channel One News, my name is Nakwama Siamafo.